ImmuSoft's first practical application, ImmuSoft's first clinical indication is for a rare genetic disease. And in the case of these rare genetic diseases, patients often can't produce enzymes that they need to survive, or they produce broken enzymes or broken proteins. Typically, they would have to be treated with a stem cell transplant, or they would have to have this missing enzyme injected for the rest of their lives. With our approach, we're able to take the patient's cells out and give them the instructions to produce those treatments, and then put them back in their body where they'll produce the treatment 24/7 for many years.
Awesome. So where is ImmuSoft in the development process for all of this?
So ImmuSoft has been working on this technology since 2009. It originated in the lab of David Baltimore, a Nobel laureate at Caltech. And he had built an earlier version of this system that programmed stem cells with a virus and then made these immune cells, the plasma cells that secreted HIV antibodies. When we licensed this technology, we modified it so that we could use simple immune cells floating around your blood and not need the virus anymore. And so we've done this, and we've showed that we can make the cell. We've shown that we can make these cells produce antibodies, enzymes, and other biologic proteins. We've shown that we can modify these cells to make useful therapeutic proteins, and that we can take these cells and put them into animals, and they will migrate to the proper places where they could survive. So now we're engaged with the FDA doing regulatory paperwork. We've shown that we can modify these cells to produce useful, keep my terminology right. We've shown that we can put information in these cells with our platform that will make them produce useful treatments. And then we've also shown that we can put these cells into mice and that they will properly migrate and function in the animal. So now we're working with the FDA to begin human trials.
The tagline, again, was it programming your cells to cure disease?
Yeah.
Okay. Do you want to just get a couple takes of him just saying that? Like ImmuSoft is programming your cells? So ImmuSoft is programming your cells to cure disease?
ImmuSoft is programming your cells to cure disease. ImmuSoft is programming patient cells to cure disease. ImmuSoft is changing the information. ImmuSoft is giving your cells instructions to cure disease. We did like a million versions of this. I don't know which one you guys will like more.
One was, I think just having a couple.
Yeah, you know.
One was ImmuSoft is using innate qualities of immune cells to fight disease.
Yeah. ImmuSoft is using the innate qualities of your immune cells to cure disease.
Awesome.
ImmuSoft is using the innate qualities of your cells to treat disease.
Do you want to say, this is probably in there, but ImmuSoft can make a new treatment by uploading a new program to turn your body into the drug factory?
Yeah.
That might be in there.
The beauty of ImmuSoft's technology is that making a new treatment is as simple as adding a new program. So the process is the same no matter what disease we treat. All we're doing is giving new instructions. So any conceivable new molecule or therapeutic that you can devise, we can take the genetic instructions for it, put it into your body, and turn you into a drug factory. So instead of having to design an entirely new process to purify a treatment, to produce a treatment, to ship it, to stabilize it, all we have to do is drop that new program into your cell and it will make it in your own body. All of those steps go away. So it allows us to address drugs that are very rare and very difficult to treat with traditional means. So this allows us to treat diseases that are This allows us to rapidly produce treatments for diseases that are otherwise very difficult to produce therapeutics for. A mouthful. Since all we need to do to produce a new treatment is add a new program to the cell, we can produce new treatments very rapidly. So we can. I'm trying to avoid talking too much trash about specific pharma companies.
Yeah.
So normally.
Keep using ImmuSoft in there
yeah.
too. I'll just keep reminding you.
Yeah, do. I won't take it personally.
Yeah, another one was we had a couple different versions of changing the instructions of the cells. They go into your body, make a treatment out of it, and they're long lasting. So do you want to say that in different ways?
The beauty of ImmuSoft's treatment, the beauty of ImmuSoft's technology is that you can make a new treatment by simply changing the information in the cell and putting it back in your body. Once you put the cells back in your body, they'll survive for many years and produce a therapeutic. The beauty of ImmuSoft's technology is that creating a new treatment is as simple as changing the genetic program. The beauty of ImmuSoft's technology is that producing a new treatment is as simple as putting in a new plasmid.
Awesome. Yeah, so who are you guys? What's the team? What are the strengths?
So ImmuSoft's core technology came out of the lab of a Nobel laureate at Caltech. ImmuSoft's core technology was licensed from Nobel laureate. ImmuSoft's technology was licensed from David Baltimore, a Nobel laureate at Caltech. We recruited a chief scientist. Should I mention the names of everyone? Go on.
I think so. I think I know people's names.
Yeah. All right. So ImmuSoft's core technology was licensed from the lab of David Baltimore, a Nobel laureate at Caltech. We then recruited Eric Herbig, a chief scientist with a PhD and MBA from the University of Washington, to develop the technology. Recently, we've been...
So I feel like it's sounding, right now, how you're describing it sounds like a presentation, as opposed to you're just talking to somebody and saying, this is our team.
Yeah.
You know what I mean? Like just as if you're explaining, like, this is our team, this is one person, but it's more conversational, I guess, if that makes sense.
Yeah. Our chief scientist is a guy named Eric Herbig. He's got his PhD and his MBA at the same time from University of Washington, and he's the lead singer of a band. The guy will read medical journals while composing 12-track music on a pedal bike. We've recently been joined by Scott McIver, who's been working in gene therapy since the field began. He's had his hands involved in almost every gene therapy trial that we've seen. I don't want to go too over the top with this.
Yeah, before, when you described Scott McIver, you said he was doing gene therapy before it was called gene therapy. Yeah, kind of like that.
Yeah. We've recently been joined by Scott McIver. We've recently been joined by Scott McIver, a guy who's been doing gene therapy since before it was called gene therapy. He is also one of the inventors of the Sleeping Beauty transposon system, this non-viral vector that we're using to modify the cells. He's also been personally involved in the production of GMP cell therapies and several gene therapy trials.
So you a wrap up of the team, like a summary of your team.
Like more high level?
You have a strong
Yeah.
team of experts.
Yeah. So our team is comprised of all the core people who our team is comprised of the core. Our team is comprised of the inventors of all of the core technologies that we depend on. We also have leadership. We also have leadership that's been. We also have leadership who. We.
Can you say again what you're looking forward to?
So
Yeah, I want to hit the business side of it. Is what I'm I'm stumbling on this transition to it.